right-sided EKG, your limb leads are going to be exactly the same as you would with a regular 12 lead, so you can go ahead and put your limb leads on here. Okay, and then what's going to be different is your V1 through your V6. Okay, so basically your V1 through 3 are actually going to go on the right side, okay, and your V4 and V6 are going to go on the back, kind of almost back to the vertebral column, all the way back there. So I'll put my precordial leads first. Okay, so V1 is actually going to go at the mid-axillary line, okay, at the 5th intercostal space. So that's going to go way over here, okay. V3, what's normally V3, is going to go mid-collarbone straight down, okay, at the 5th intercostal space. And then the V2 is going to go right in between, okay. And then, so we can get those connected, and then we'll connect the other 3 on the other side there. Mannequin skin does not. Should have stuck these on first. Okay. Now we're going to have to move the mannequin a little bit. And so basically the V4, okay, is going to go just posterior to the mid-axillary line. Normally V6 is at the mid-axillary line at the 5th intercostal space. So the V4 is just going to go posterior to that at the 5th intercostal space. And then the V6, which on here is going to be considered V9, okay, is going to be just off to the side of the vertebral column at the 5th intercostal space. So, right, we'll just do right there. And then V8 is going to go right in between. So, depending on the size of your patient, that's kind of why I do that way. They're all hooked up. And you're going to wait for your EKG. Okay. Once you're ready, you do your same EKG print, and then when it prints out, I'll just put in that down EKG.
And what we were asking you to do, if you do a posterior EKG or a right-sided EKG, is that you put in the comment field on the EKG, so that way when it's transmitted, they can see that because it's not going to be a photocopy, so that the cardiologist reading it can see this is a posterior EKG or a right-sided or whichever specific EKG the physician's asking for if it's not a normal 12-lead.
So you're saying you're going to have them, when they're putting it in Muse,
Yes.
put in the comment section?
Put in the comment section,
Posterior,
posterior
gotcha.
EKG.
Okay. Yeah, because it's easy to hand write, cross out. You would cross out V1, V2, V3, and you'd put in RV, for RV5, RV6. But yeah, I was I wasn't sure how you guys do that, because we normally just do it and then change it here and then send it to medical records to have them manually scan it in. Because these monitors only do a 15-lead EKG, they won't do an 18-lead EKG. So you can't actually have both of these on there at the same time.
To do a right and posterior?
Yeah, at the same time.
Okay.
You can only do one or the other.
I was going to ask you that, so that's my question. So that's
yeah, you can only do one or the other, and then you can put in what leads they are. You have to know though the password, your setup password on the EKG in order to manipulate it. It doesn't let you just do it without having a password.
Gotcha.
Can you roll him and just show me those?
Sure, they may have come off.
And which ones, which?
So this is V7, V8, and then V9.
Perfect.
Yep.
All right.
And you're using V4, V5, V6.
And I'm gonna create some diagrams and they'll be on the EKG machines as well. Cause I wanted Travis, cause we'll get, rarely a posterior, we'll get a right-sided request. So can we show him just a simple right-sided EKG as well, Travis, just the, not the posterior, but just a simple right side as well?
You mean this right here?
Yes, just the V1, V2, and just the right side, not the posterior. Cause they may be asked for that, just a simple right-sided too, not a posterior.